We have some more really exciting stem cell therapies to talk about today, and this next one is something I found almost hard to believe. We're going to hear about another example about how human cells may be able to transform and perform remarkable feats of healing. Please welcome Dr. Joanne Kurtzberg to tell us more about this remarkable therapy, not just for cerebral palsy, but also for autism.
So I'm going to tell you a little bit about how we're using cord blood and cord tissue as therapeutic cells to treat children with cerebral palsy and autism. And I have to just say a couple of words about how this whole story started. Back in 1988, there was a little boy with Fanconi anemia who needed a transplant and got one from his baby sister's cord blood. And that was the first demonstration that cord blood actually had blood stem cells that could reconstitute bone marrow in a transplant. And you can see on the right, 30 years later, he is healthy, he's taller than me, and most importantly, his bone marrow is comprised of his baby sister's cord blood cells. So his transplant, first in man, first in a child, paved the way for the whole field of cord blood transplantation. I'll show you just a couple of videos of one little boy on the phase 1. So if we can start this, you'll see this is a test where he should name pictures.
We're going to look at some pictures. I need you to tell me what they are, okay? Here, my turn? Okay. Oh, thank you. What is that? What is that?
So he doesn't talk and he doesn't really make eye contact.
That's a dog?
He's typical of an autistic child of this age. And if you look at him at his next testing, which is a year later, and we start this video.
Ready?
Yes.
What is that?
It's a banana.
Super peaches and stuff. What is that?
It's an airplane. Flying goes. Goes down, down, down. It goes.
Yeah. That's an airplane.
Then goes.
So he's talking, he's making eye contact, he's imaginative, his scores improve. And this was the kind of improvement we saw, and this enabled us to go, oh, here he is, even 6 months after that, just skiing down a mountain, not bad.
So, Joanne, we don't have much time, but let me, a couple of little quick things. So if using these placental or cord blood that you talked about and processing them, that will then enable you to have enough cells to, assuming regulatory approval, to treat many or most of these 17,000. The demand obviously is going to be massive.
Yeah,
and we need enough cells.
Well, there's plenty of cells. It's not a source issue as long as we can use donor cells. Yeah.
So then, who are the right candidates here? Does it depend on age, when you treat them, the severity of their symptoms and so forth? How do you decide?
So we need to do more trials. So our trials have really focused on very young children, and there we can't see an age effect, but it may be that we haven't looked at a wide enough age range. So we hope in our next series of studies to look at older children with autism, young adults with autism,
Wow.
and older children with CP.
And this seems to be a durable effect.
Yeah.
In other words,
Yes.
you don't have to keep infusing, or it doesn't seem to wear off.
So it does not wear off. But with the children with CP, they build on, once they have more function, they build on having more function. With the children with autism, I can't prove it, but I think we're going to want to give them multiple doses, and that's why the MSCs have a lot of value, because we can make multiple doses from the same donor.
Terrific. Dr. Joanne Kurtzberg, thank you very much. Very exciting.